if you want to show more of a chart, more of a description, you could also just, the data that supports that they're equivalent is basically a survival chart that shows the two different treatment options, mastectomy versus breast conservation with radiation, at the end point being at 25 years with the same outcome, right? The same survival. So just like almost like a line chart, and two things are equivalent if people need it to be more visual.
That's also a neat idea. And in the kind of mental model that you have of that, because of the concerns that Carrie was articulating about being explicit with numbers, both in terms of just quality of data and then also just how much individual prognosis can vary depending on various factors. Would it work for like what you were saying is if we did a kind of a survival chart like that, but maybe like the y-axis isn't labeled numerically. So like it gives the visual indication of these curves are the same, but it doesn't specifically say, like at 25 years, your risk, your chance of survival is, Y%. Would it work without the y-axis? Yeah.
Exactly, right. But just sort of, that's the amount of data that we have to show that they're equivalent in terms of the end result.